Friends, in this video, let us see the extensor retinaculum briefly. So, first of all, let us see its formation. Okay, any retinaculum, any retinaculum is nothing but it is a modification. Okay, it is a modification of deep fascia. Okay, wow. So, here let us confirm that this extensor retinaculum is nothing but a modification of the deep fascia in the anterior compartment of the foot, okay, or leg. Okay, this is the modification of the deep fascia in the anterior part of the leg. Okay, next let us see the course. Okay, let us see the course. So there are two parts. Okay, superior extensor retinaculum, which I am marking in the diagram, and inferior extensor retinaculum. Okay, there are two retinaculum. Okay, dividing into two parts: superior extensor retinaculum and inferior extensor retinaculum. The superior extensor retinaculum, let us see the course. Okay, the upper end. Okay, the upper end is attached to the. Okay, this is anterior border of tibia, and this is anterior border of the fibula. Okay, now, also I need to confirm this. This is medial side and this is lateral side. As we know that medial side, the tibia is present and in the lateral side, fibula is present. So, in the medial side, the superior extensor retinaculum is attached to the lower border of the tibia. Okay, this I am marking here. Lower border of the tibia. Okay, and where it ends means lower border of the fibula. This is the lower border of the fibula, particularly at the lateral malleolus. Okay, so the superior extensor retinaculum arises from the lower border of the tibia and ends in the lower border of fibula, that too particularly lateral malleolus. So now, as we seen the superior part, okay, the superior extensor retinaculum is cleared here. So now let us see the inferior extensor retinaculum. So the now, the inferior extensor retinaculum is Y-shaped. I need to confirm. Okay, this is a Y-shaped. As in the diagram, we can see clearly it is Y-shaped. Okay, now let us see clearly about the inferior extensor retinaculum. Now let us see clearly about the inferior extensor retinaculum. So the inferior extensor retinaculum is also divided into two parts. One is upper band and the lower band. Okay. Now let us see it clearly. The upper band. Okay. The upper band. Okay. The upper band is attached to the medial malleolus, which I am marking here. Let us change the color. Okay. The medial malleolus. Okay. Medial malleolus of the tibia. Okay, it is attached. Upper band is attached to the upper band, particularly the upper part is attached to the medial malleolus. Okay, now the lower part, lower band. Okay, the lower band is attached to the deep fascia of the sole. Okay, there will be sole downwards, right? The upper is dorsum and the lower one is the sole. So it is attached to the lower band of the sole or deep fascia of the sole. Okay, so now the lower part, the stem of the inferior extensor retinaculum is attached to the calcaneum bone, okay, laterally. So because it is present in the lateral side, okay, this is present in the lateral side. So the stem of the inferior extensor retinaculum is attached to the calcaneum laterally. So in, we have cleared that the course of the extensor retinaculum. Now let us see the structures passing structures passing deep to the extensor retinaculum. Okay. So remember the structures passing deep to the extensor retinaculum. There is one trick. Okay. Trick to remember. So the trick is the Himalayas. Okay. The Himalayas are not dry. Okay. Dry places. Okay. Now the trick is this one T. First letter will be the trick to remember. Okay. So it is nothing but tibialis anterior. Okay, from the diagram we can clearly see. Okay, okay. From the diagram we can clearly see this is tibialis anterior, which I am mentioning here. Next, this H, which is nothing but extensor hallucis longus. Extensor hallucis longus. Okay, tendon. This is also one of the tendon. Okay, so no need to confuse here. Okay. Now this A is nothing but anterior tibial artery. Anterior tibial artery. Okay. Next, this N is nothing but nerve, which I am representing here is deep peroneal nerve or anterior tibial nerve. One is deep peroneal nerve or anterior tibial nerve. Both are same. Okay, from the diagram it is mentioned clearly. Next, the D is nothing but extensor digitorum longus. This is also one of the tendon. Okay, wow. Next, the P is nothing but Peroneus tertius. Peroneus tertius, which is present in the lateral side of the leg or foot. Okay. Now let us see it clearly. Okay. Now let us see the surface view showing the schematic diagram to show the relations of the tendon and vessels, nerves to these retina, as I already mentioned, right? So we need to confirm. Okay, we need to know one important point here. What does means the extensor digitorum longus, right? This tendon is dividing into four parts, which is supplying the all four toes except the great toe. The great toe is supplied by extensor hallucis longus tendon. Okay.